Hello, everyone. Good afternoon. Welcome to the WRASAP Network quarterly meeting today. We are part of the Western Regional Agricultural Stress Assistance Program. My name is Esmeralda Mandujano, and I am tasked with hosting this quarterly meetings for our network in the West for Farmer Rancher Stress Assistance Network. I work out of UC Davis, and our program is happy to collaborate with the WRASAP Network. Today, we will be focusing on community-based partnerships for farm worker outreach. And our presenters today are going to be Teresa Andrews from the Western Center for Agricultural Health and Safety, and myself. But first, I'm going to give you a little bit of background of the Western Regional Agricultural Stress Assistance Program. Slides over. Here we are. So the mission of WRASAP is, it really started because it was funded by USDA NIFA under the Farmer Rancher Stress Assistance Network. And the grant establishes regional networks that connect agricultural producers. That includes farmers, ranchers, farm workers, and others in the agricultural related occupations. And what we do is we connect them with resources to assist them in times of stress. There are four general regional programs in the United States, and we are the one for the West. For the West, under the Farmer Rancher Stress Assistance Network, we are WRASAP, and our efforts include a clearinghouse where we are working with partners at Farm Aid to increase the number of resources we have in the clearinghouse, so kind of like a database to find resources. A small grants program, which we've had a few cycles of this one. And the intent behind this small grants program is that we are able to fund other projects that come along as we're moving through the work of WRASAP and partners. And another intent is also to grow the number of partners working with us and us being able to support them. Another effort is that we've extended call staff hours of other support lines and resource lines around the country. One of them being the Farm Aid Hotline, and another one being the AgriSafe Stress Line in a few states in the West. Both of those were initiatives that started in the East, and we thought, well, why recreate the wheel? Why not just expand what's already working into the West? And then another effort is a network. And the goal of the network is to connect with others who are working on reducing farm stress, to work with each other, learn from each other. This is the area of the West. We work in 13 states in the West and 4 territories, which include Guam, Micronesia, and American Samoa, and also the Northern Mariana Islands. We've had great partnerships out in Guam and some of this other territory. So we understand the West is very expansive and a very dynamic territory in terms of its diversity and also its farming. So it's a really big area, and all the more important for all of our networking efforts. So these are just some of the partners that originally signed on. Like I said, the small grants program has allowed us to further incorporate other partners. So some of the ones that we've been working for a long time have been Farm Aid, Montana State University, who worked on our baseline surveys, and you can find those under farmstress.us under baseline. There's baseline surveys for farmer populations, farm worker populations, and also some of those are aggregate for 13 states and 4 territories. And there's also a few for specific states where we had enough data to provide information on what are the needs for farmers and farm workers in relation to mental health, and also how would they like to receive information. And that database, that baseline data has helped us to inform some of the the efforts that we're trialing across the United States. For example, one of the ones that kept coming up was the need to build community, and some of the efforts that have come up from that is partnering with other organizations to host pizza for producers. So in California, we just hosted pizza for producers with our partners at Center for Land-Based Learning, and all of those efforts are informed by the data that we collected through the baseline surveys. So what are these WRASAP meetings and why do we hold these networking meetings? These are meetings that are intended for stakeholders, and stakeholders are able to build connections and collaboration to assist agricultural producers in times of stress. Another goal of these meetings are to improve behavioral health awareness literacy and outcomes for agricultural producers, their families, and communities. Also, collaborators get a chance to present their efforts and offer opportunities to pose questions and bring experiences to the table. The meeting is open to the public and to external partners. Again, one of the main goals is for us to have a conversation and talk about some of the things that we're doing and how we can collaborate to better serve our farmers, farm workers, to help them reduce farm stress. Next one. Okay, so we're gonna go now into our icebreaker. Angelina's gonna split us out into some breakout rooms, and in these rooms, we're going to share our name, our organization, if we are affiliated with an organization, and also what are you looking forward to this summer? California has been pretty hot, so it already feels like summer, even though it's not here quite yet. So just share with your group, what are you looking forward to in the summer? So I got to learn some very interesting things in my group. People were more like, want to stop and like really be able to absorb what the summer is going to be present, live in the moment. So that was neat. And then we went on to this big conversation about mobile medicine, outreaching to farm workers and some of the work that's happening, at least around California. And so that was fun. We got to not only talk about what we're looking for, but also in relation to our topic today, which is working with farm workers. Anybody else want to share what they're going to do in the summer? You know, Dawn said flying, so that was good. I'll pick on Teresa since she's the co-presenter.
I'd say I would like to use my bike.
Your bike?
My bike and ride outdoors when the weather is nice. Maybe in the morning because it seems like it's going to be a very hot summer.
Yeah, I was gonna say might scorch around 1 p.m. Cannot be out in the bike.
Yeah.
All right. Anybody else would like to share?
Pues a mí me gusta trabajar en mi jardín.
Gusta trabajar en su jardín. ¿De dónde se reúne con nosotros hoy?
Yo soy de Salinas, California,
Okay, great.
y aprovecho los días que están los sunny days for gardening, porque sometimes it's cold with con la brisa del mar. We are cerca del mar, entonces aprovechamos los días de sol.
Okay. Norma's near Salinas, and when it's breezy, she goes out to garden. Awesome. Somebody else? Gracia, would you like to share?
Yeah, I was in the same team with Esme, and I don't know, I think for this summer, it's stop and stare. Just that. Just stop and stare around life and gorgeous weather and people around and everything that is happening in life. Yes.
These are great also because it's like I always like to ask these things in these meetings because as service providers, it's important for us to also remember that we have to practice what we're educating on and taking care of ourselves of ourselves so that we can give the best that we can when we're out there providing our services. Okay, great. So with that, we can move on to our main presentation for the day. So just briefly, we'll go into our agenda. So we did introductions and our icebreaker, then we'll move into our main presentations, some quick announcements, and then we'll close from there. Okay. So this is just a little bit about our presenters today. I think most of you here have heard enough about me. So I work at the California Agribility out of UC Davis, and I work on several of the programs that our department runs all around farm health and safety for farmers and farm workers. And Teresa, she works for the Western Center for Agricultural Health and Safety. She's an education and outreach specialist for the Western Center, and she has extensive experience as an educator developing educational materials and conducting training using popular education and participatory adult education methods. So I've worked with Teresa for a number of years, and I always kind of tell her this, that she just has this magic where she makes things work and like really translate research-based information into information that's practical to use with farm workers, and that's very important in community work. And more specifically, very important for community-based partnerships for outreaching farm worker populations effectively. Okay, so why do we work on community-based outreach? One of the main reasons is that it helps to better serve communities that we may not be familiar with. And it helps in delivering information to communities that have been underserved or underreached by the healthcare system. This is important because oftentimes we'll say some of these populations are hard to reach, and there aren't a lot of efforts put into them. But we have to just remember that oftentimes it's because it's the underserving these communities is really because we're underreaching them, and there are ways to reach them. We just have to sometimes get creative. Also, community-based outreach is important because it's culturally and linguistically effective. So being able to communicate the message oftentimes translates something from research into something that is culturally relevant and comprehensible can be a challenge. But it can take a few times to get there, but it's possible to get there. Can I add anything, Teresa?
You're doing great. We can go next.
Yeah, we can go next. And I was just kind of saying also because Teresa and I talk quite a bit about different projects that we work on together. And I feel like every time that we discuss these things, there's so many different points of view that come up. And I think it's important. And one of the ones that we had mentioned too is that it really reaching somebody, we just have to think of everybody's unique. And there's a different try that we have to do. If one thing doesn't work, then we try a different one. But there are some guidelines that we can follow.
So for this one, Esme and I like the building the bridge, because if you think of a bridge or a puente, they connect two sides of everything. And the two sides is both ways, one way and then coming back your way. So Esme mentioned, and we use a lot, I have heard this like hard to reach communities, but we don't know if that community is thinking the same of the other community and is thinking of them as the hard to reach. In reality, it's hard to reach because they are not talking. And it's hard to build a relationship if you don't talk. So building the bridge is using community leadership. In the Latino community, there is this very natural and organic model where people identify leadership within the community, and those are the people that go to ask for, can you refer me to, do you know how to do this? So it's in the indigenous communities, in large cities, small neighborhoods. It's very kind of the way Latinos are. We kind of like to talk, and we have a network. And in that network, there are people that are showing more like leadership skills, and the community respect and follow them. So they are called promotores. And promotores, as I say, is very culturally effective, and something that is very practical to start building the bridge between your organization, your research project, or whatever you are trying to do to serve or to connect with that other community. Esme?
So working with promotoras is something that's actually now recognized and data backed. There's a few research studies that have looked at the effectiveness of using promotores or incorporating promotores into their work to deliver the message out to communities. And there are some studies that have looked at promotores being effective in delivering messages of cancer, cervical cancer. There's one project on cervical cancer. There's another one on breast cancer. There's one on blood pressure. And there is one that looks at mental health and the effectiveness of promotores in delivering mental health messaging. This one was more observational, and it was done around like the COVID-19 pandemic. But promotores models are also recognized by the National Centers for Chronic Disease and Prevention and Promotion and Centers for Disease Control and Prevention. So it is, there a few years ago, there wasn't much research around there, but as we have moved in more, I wouldn't say in the last decade, there's more and more research studies that have looked at the effectiveness of working with promotores or incorporating promotores into some of the models that of delivering health information, health education.
Yeah, and something that it works for different groups. It doesn't have to be Latino communities. It could be with African American, with Pacific Islander communities. If there are people that understand the mainstream American culture, they speak English and feel comfortable moving in that other American culture, and then they go back to their communities and speak the language, understand the cultural environment, then they could be ideal to start building the bridge between those two groups. Because these are people that, if they were fish, they can like swim around in both waters, like the American mainstream and their original native culture. They are bicultural, they are bilingual, and they are going to be able to translate the content for the two different languages. I have the pleasure to work with different groups, and it's like researchers need to tone down the kind of information, not like dump out down the information, but use different kind of words to explain the same things. So they are talking the kind of language the community is going to feel comfortable using and transferring to others when they are talking about that. So the bicultural and mutual understanding is key for both groups, the ones that you are representing and the one in the community, for them to be able to transfer information both ways and then tailor the key messages in a very cultural, sensitive, and respectful way. So next, I want to tell you a little bit about, next slide. Yes, thank you. What is a promotor? Usually, most of them are going to be like immigrants to the country, and they want this feeling of, I want to belong, I want to succeed in this new country. So they are passionate, they have a good desire to help others with very, very empathy, to say, you know, when I was coming to this country, I was feeling like disconnected, and I know I feel this empathy for others are just new to this country, and I want them to help to connect and to belong to the new world. So because they show this caring and passionate and empathic behavior towards their community peers, they are respected in their community. Usually they are going to be people that go out and trying to learn. Promotores are eager to learn new things, understand new things. And when they understand and knew that those things, they are going to transfer the concepts and the knowledge to their peers. That's why we say they are cultural and language brokers. I'm going to mention one example. I was talking with some investigators back in San Diego, and they were using, it was a research project, and they were using the word like subjects for recruiting participants in the Latino community. And the promotores told the researchers, you know, when you talk about subjects, I feel like you're talking about things. Someone that is no personal, it has no value. It's just something you are going to be using for your research. Could you use another term? And then the researchers start using participant. Out when the promotores were doing the outreach for people to participate in these research projects, the participants were still the subject of the research, but they were not subjects, they were participants. And before it was difficult, the researchers had difficulty getting the participants coming and joining the efforts. As soon as they used a different word, participants were coming. So cultural and language brokers, they didn't change the concept, they didn't change anything about the interviews. The only thing it was now more personal. You are a participant, you are not a subject of the project. And because of that, they build relationships. The bridge concept, they advocate because they speak up for their group. And they can also speak up about your project, about your research, about your education. You want to reach out to this community because they are representing both groups. Peer educators, very successful, and ahead we are going to talk about other examples. Most of them are volunteers, some of them receive stipends, and some of them are are staff of the agencies. Whatever is the status of their involvement, the personal characteristic of the promoter are very similar, very passionate, people with empathy, and people can advocate for the groups they are representing. Next one, Esme.
And we'll dive a little bit into the history of promotores. So most of what is known is from the history of Latin America, Africa, Asia, and the Middle East, and based on social and cultural uses. A lot of that isn't documented. Some of the first stuff that I have found documented is from the 1950s, and it's from the Mexican health system, which gave rise to the Promotores de Salud health promoters model. And in this model, community members were utilized as a link between neighbors, education, and serve community resources. So they served not just like as a one-to-one link, but they linked in different ways. So a lot more like a network. At present, promotores are integrated into the health system. This is more of what we've seen more recently. But some of the community-based root models of promotores are some of what has always been there traditionally, even though it hasn't been documented. In the 1950s, the Mexican government really did a big push to incorporate promotores de salud into their health system. And to this day, promotores de salud are very big in the Mexican health system and even more in rural areas. We've had the opportunity to work with some of these promotores that also come to train up to Northern California. It used to happen a lot more before COVID. I think it's just like retaking But they would come and train and also train promotores up here. So promotores de salud are a really big portion of how health education is delivered in Mexico. And in the late 1980s, they were well known in the migrant and seasonal farm working communities. In 1988, California first used promotores programs through organizations working on the AIDS and HIV crisis. So this is the first time that we really see them integrated into health models, and some health promotion clinics incorporate promotores as part and paid partners or paid employees into some of these clinics and health-based organizations, health education-based organizations. From there, we start to see the branching into community health worker. Oftentimes we were using the word promotores, but now we see integrated more into the health system as community health workers. Community health workers and promotores models can vary. Community health workers tend to be more assigned to just one role, delivering information on one specific health education topic, or maybe a couple, whatever the focus is for the clinic or the organization that is hiring them. Promotores based on the community tend to be more informed about a lot of different resources, because they are not tasked with an agenda of this is the information that you're going to distribute out into the communities. It's more of like they love to learn. They love to learn about resources, so they tend to have a lot of information about different resources. Again, these are the ones that are more like community-based, not necessarily affiliated with a clinic and not working under that community health worker role.
One of the things that I think differentiate a little bit is like usually community health workers are people that are working, like a staff of a community clinic or a community-based organization. And the term promotores is like the volunteers, trained volunteers that help to expand and outreach out other community members. The characteristic, as Esme say, is maybe they are contacting someone with the intention of talk about nutrition, but if the necessity or the need for the family to learn about something else is there, and the promoter know a resource, they refer the person to different resources based on the needs of the family or the person they are reaching out. One of the examples of how promotores were very successful was in the 2020 COVID pandemic, because there was a lot of misinformation in the Latino community. Latino community use a lot of social networks, but sometimes it's gossip. Sometimes they are not accessing the right social network with information. And with COVID, it's something like that was happening. So people were afraid, like if the chip in the vaccine, or they are going to create some like problems for people that wanted to have babies in the future. So it was a lot of fear and a lot of disconnect. So promotores were key to pass the right information and give the right referral for people to get whatever they were needing, and also to get the vaccination. They were very successful helping people to get the vaccine and respond all the questions. So the fear was not there at the end. And they are helping in very different situations where there is an emergency. A very strong network of promotores could be the solution to start reaching out and bring the answer to the communities.
One of the things that also happened because of the COVID-19 is that it was noticeable, like Teresa mentioned, that the need for this role of somebody being in the community and being able to reach and give this important messages to combat misinformation. From there has been more funding allocated to incorporating promotores into like federally qualified health centers and other organizations. Again, that is, even though it sprouts from promotores, really what that is doing is that it is funding community health workers And again, the role of a community health worker can be different than the role of a promotor, because the promotor has more of that volunteer part to it, and community health workers might be more tied to like an 8 to 5 work week. And promotor is really like, it's kind of like a calling. It's part of how you live. You volunteer, you do this to help your community. So those are some of the things that we've been seeing.
Yeah, something important too. Usually promotores, they have the regular work and then they do this volunteer work. When they first learn what they are going to be talking about, the topic, and you want them to reach out to the community, and then they are going to disseminate the program. They can help with health fairs, or they just do it with their neighbors. So the benefit of collaborating with promotores is because through interaction with them, community members feel heard with their cultural context and are more receptive to the messages and resources that are provided for them. And also I told you, remember, we started saying they are bridges. I'm going to tell you an example, and it's kind of funny, but not really. There was a doctor in LA, and she was trying to talk to people and how to control the diabetes. And one patient came and said, doctor, can I eat a gansito? And if you are a Latino, you know gansito is like a pastry. It's chocolate filled with a strawberry and cream. And then the doctor, when she say a gansito, this is like a small duck, I would say in English, we could say. And the doctor understood that this person was talking about ducks. And she said, well, it's nothing wrong if he eats a gansito. So she said, yes, you can eat a gansito. Next visit, the patient comes and say, doctora, you say it's okay for me to eat a gansito, but every time I eat a gansito, my blood sugar goes up. Because it was the disconnect. The cultural context was total. The patient was talking the past three the direction to set everything in the cultural and language context. So, Esme?
So now we'll dive into the steps of what we're doing. But before we go into the steps, it's really important that before you reach out to promotores groups that may be in your community, it's really important to become familiar with the history of the community that you're reaching out to. Also, asking open-ended questions. There's really no dumb questions. People are always happy to ask to get questions to learn, because to learn more about them. So that's really important. And to think about how you will show up. That is also important, because in the general sense, how we approach communities, it can impact them. We have to remember that it is important to show up with humility, and keeping in mind that your community, that this community that you're approaching has a lot to offer you. I think oftentimes when we come in as educators or experts, we're so ready to deliver our message that we kind of forget to listen to what the other person has to teach us. So it's important that we practice cultural humility, and again, that being that we have to think less of ourselves and also let others teach us about them, and having a mind and an understanding that this is a lifelong process. Even though you start working with a certain community, it doesn't mean that you're going to understand them 100%. Just as people, we're always evolving, and the same with communities. Also important to check in with our power imbalances. I know oftentimes some of the examples that people would say to me would be like, well, they show up in a government vehicle, and that can be a little bit triggering to certain communities if you don't understand the history that they might have with the government. So before you reach out, it is very important to understand and respect the history and culture of community with whom you wish to connect. Be aware of possible power imbalances and acknowledge the importance of institutional accountability. Checking in with the power imbalances, again, it's very, very important, just because I know for me, oftentimes, when people did know that I worked for a university, immediately they look at you differently. And for me, it was more of like, yeah, I have a message to come deliver, but it's also really important for me to learn from you, because you have as much to teach me as I have to teach you, or even vice versa. I feel like I often walk away learning more from them than what I leave them. So that's also very important. It's also important to keep in mind that extraction of resources, whether that's knowledge or just understanding of how culture goes, is something that still happens, and it happens a lot in academia. And it's important to recognize that that might not even be our main intent, but sometimes we still do it as educators and as researchers. So now we'll move into steps to developing partnerships with promotores. So again, before you engage, get to know your community and identify the reasons for wanting to work with this community. So what is the main reason why you would want to work with them? And also, what is it that you would leave in that community? Again, try to think, how can we leave more than we take in those communities?
So Esme, I would like to share with you something, a process that we live with a community group that was hosting a conference for promotores. When we learned about the conference, we tried to work with them, but we came with very humble approach, like how can we support you? In the developing of partnerships, we were there like, let me learn what you are doing and how it has been working. And then we start talking to them to take action, and how we could support. They identify things like helping us with the agendas to make them print in a very more professional way than they were doing it, reaching out to other groups that could come to the conference. And then we sustain the partnership by helping them to move on. At this time, Esme is taking a leadership role with the group, but it was like an organic way of working with them. It was not like we came from the university and we have these resources and let me show you how to do it. It's like, no, tell me what you're doing and tell us how we can support you. So now it's the way we are interacting with them and sustain the partnership.
Mm-hmm. And also, after the event you support, or whatever it is that you wanted to work and support them with, it's important to keep the conversation going. As Teresa mentioned, after that event that we started to support, we would hold another meeting afterwards, and in there we discussed what went well and what we learned and how we were going to continue after that. Oftentimes we're very busy and moving on to the next thing that we have to do, but that's something that we did very intentionally. And we also acknowledged the work that everybody did, the volunteers did, and in sustaining the partnerships. I know we talked about the promotores, and in terms of a lot of the time them being volunteers. In this partnership, we make sure that the volunteers are acknowledged, whether they're helping in the event, or we try to give them like a gift card, or even acknowledge them by giving them some flowers during the event, something that helps them understand that we value the work that they're giving in those events. And that's really important in continuing the conversation.
Something that we started doing like 5 years ago was recognizing the promotor, the volunteer of the year. And now the promotores that attend the conference, they send a suggestion of who could be the promoter of the year and why. And they send this small bio, like why they want this promoter being recognized. And at the annual conference, we give them a plaque. And it's a plexiglass plaque, and they really like it. And they come in front of everyone and say, so and so because of this and that is recognized by their peers as the promoter of the year. And we don't have a lot of money to do these things, but those small things like the flowers, the notes, the plaque is really keeping the move motivated to keep going with us and with the community more than anything. More than with us is with the community.
Yeah. And I think it's also important to mention that as our network continues to grow and we get more people or organization representatives that are joining in, I think at one point where we were talking about who would get the Promotor of the Year award, some of the suggestions were like very prominent professors that have done community outreach work. And one of the things that we said was like, they don't need another recognition. It's the promotores that are down in the community that need this award or something that acknowledges the work that they're doing. So that's something that we educate also new members of this network to understand, that we are trying to highlight the work of the people that don't necessarily get paid to do this work. They do it as a volunteer, and they do it because this is something that they love. And we see that as something that helps us sustain the work that we're doing, because it's important for people to feel recognized, especially if they're doing things as volunteers. So now we want to move on to, what are your experiences and opinions regarding the model that we presented? Or do you have any questions, or have you worked with promotores in the past? What has been your experience?
Could you repeat that?
Has anyone worked with promotores in the past? Or what has your experience been with working with promotores? Or do you have any questions?
Hi, this is Natalie Roy with AgriSafe. So we've been in roles where we've helped train, like there may be like Proteus is a group in Iowa that it provides services, and we've helped provide training on agricultural health and safety. So they have some base training in that space.
So some promotores that are affiliated with an organization, yeah, that's a good model to follow. Now, one thing that I have to recognize. Go ahead, Norma.
My name is Norma, and I work with promotores. I started in 2007 with Promotores de Salud and here in Salinas, California, and I was volunteer. Everything you say is right. The passion to our community is the motor to be a good promoter, because sometimes our community, our people who works in the fields has a lot of retos,
Challenges.
health, and mental health, and how can help the people. And it's right. And COVID was big struggles with our our community, and we have I am charged the program Promotores Comunitarios. I think it's gonna be 15 years, and I have the red promotores for the Monterey County, and we was the first red de promotores go to the communities and bring some information about the COVID, how it's gonna be, how protect, and we have a connect with the medical residents in the hospital, and they bring cubrebocas and sanitizer, and went to the fields and give to the these things the farm workers. And it's right, all the promotores was with stipends to help them with other resources, because sometimes they don't have money to came because the gas is too expensive or don't have cars. It's something very passionate for the people who is promotor, because they work with the heart and know the community. And I like this presentation because it's like describe all the work we do, because sometimes all of us we are volunteers and something, and in the churches and the soccer plays and the community, but it's the passion who move us to help the community. Thank you so much.
Yeah,
for
thank you for sharing, Norma. Yeah, I think that's kind of the big point that we want to make here, right? That if you're working with promotores that are volunteers in the community, it's important to recognize them and help them to continue to do the work. So that is something that's really important. I am going to pop into the chat a link for a resource that Teresa and I developed under our work with Western Regional Agricultural Stress Assistance Program with WRASAP. It looks like this. It is kind of like a little bit of a booklet that helps us to it's the steps that we went over today, and then in the back it has the example of some of the work that we have been doing. You can order these. We specifically made them into folders so that you can take them out into the community to take them with you, reference back as you're doing your outreach with community with promotores into your community. So you can order these on the link that I popped in the chat. And then I'm going to move quickly to some announcements. So our WRASAP, we continue to do question, persuade, refer trainings out of our with our Oregon State University partners. So you can find more information about this under farmstress.us under events. Couple more events that are coming up are the Agribility Regional Workshop in Michigan. They've incorporated a lot of mental health topics into their workshops, and also the University of Guam is hosting another event in Micronesia. WRASAP also has a mini grants program. These are $5,000 grants that you can use to educate yourself or your organization to reduce agricultural related stress and or prevent agricultural suicides in your state or territory. Our next deadline for the mini grants program is on July 31st. We just reviewed mini grants from the first cycle, and some of the applicants applied to attend some of those workshops that I shared online. Teresa, thank you so much for presenting. I hope you guys order that folder. Again, it's a resource that we can take out into the fields to connect with farm workers. Any
Thank
last
you,
questions?
everyone. Bye.
Gracias.